Okay, so today we've got Dr. Zain Rizvi. He's Dental Student of the Year 2019, and he was the BACD Rising Star in 2019 as well. And specifically, we want to talk about him being an author of the book Know Your Drill. Is it Know Your Drill?
Know the drill.
Know the Drill.
Right here.
There's the book right there. So I really want to take this discussion in the perspective of a dental student or aspiring dentist wanting to do well at dental school. So we're going to be talking about the challenges of dental school, and then we're going to go into the ways to really thrive in dental school. So thank you for coming onto this call, onto this Zoom. Just tell us a little bit about where you are at in your dental journey, and then we'll get into it.
Okay. So I've just finished my journey in dental school. So I'm now Dr. Zain Rizvi, which is a massive relief. So I was on the graduate program for dentistry, finished 4 years at dental school, and now I'm about to start my foundation training. And that's going to be based hopefully in Luton and Bedfordshire. I'm yet to find out my practice, so that's a year-long training program, and then we'll see where we are at the end of that as to where I want to go next.
All right, and it looks like you've been involved in helping others on their dental journeys as well. So tell us a little about Toothwise and the things you've been involved in helping others.
Okay, so Toothwise was actually the company that it's actually a company that kind of posts regular updates to do with dental news and makes it very easy to digest. I did a little bit of kind of content writing for them, but they are actually also the ones that partnered with the Future of Dentistry Awards, which is they're like it's probably like the first organization that actually made dental awards for dental students. There's a lot of awards for dentists around the UK, but there's not that many for students. So I actually applied for their Dental Student of the Year award, and it's a very, very fancy, very nice award ceremony.
Yeah.
And I was fortunate enough to win that last year.
Yeah.
In terms of helping others and what I've been involved in, I actually co-founded a company called the London School of Dentistry with one of my fellow dentists, Tariq Farouk, his name is. He's in the same year as me. And we actually founded that to help not just to basically help school students with their application process, but mainly to actually give them a taster of what dentistry is like, because I didn't really know what dentistry involved until I actually got to dental school, which I thought I was lucky because I really loved it. But I was like, it's probably a little bit unfair on those who maybe thought dentistry was something that it isn't. And then they got to dental school for this 5-year degree, and then they're like, uh-oh, I'm in trouble here. So our primary focus of this kind of organization is to run taster courses for school students, and we actually get practical activities as well as a little bit of kind of seminar teaching to give students like a flavor of what to expect.
Yes, I've actually heard of that, the London School of Dentistry. So just tell me a little bit about how people would find out more about that and how they would actually enroll.
Yeah, so again, we've got quite an active Instagram page at London School of Dentistry, but our website's got all the information on, so www.londonschoolofdentistry.co.uk. We're regularly emailing out to schools around not just London, but also the UK. We are based in London at the moment, but actually with this whole coronavirus thing going on, we've even launched an online program that people can access, which I think is helpful for mainly this year's cohort that are going to be applying, because they're probably not going to get any work experience for the near future anyway. So yeah, I think the best way is to either go on the website or to find us on Instagram and send us a message. We're always happy to help people. We don't charge to help. We read through personal statements quite often for free and just give our kind of critique on it. So please do get in touch. And if you have any questions, hopefully we can answer them.
Okay, love it. What's your limit in terms of how many people you can have on the course?
So we try and coincide with the school holidays, because obviously that's the easiest time for everyone to get involved. So we generally have around probably 25 places per camp that we do, and we run it over a weekend, so a Saturday, Sunday, in kind of Christmas, Easter, summer. Last year we ran like a couple of summer programs because of demand, which was nice. And we're also now looking to introduce a kind of like a scholarship or bursary scheme in for students who are, from less, privileged backgrounds, basically,
Yes.
because we want to try and diversify and get as many people involved as possible, because it seems to be a really nice model to give students some exposure.
Fantastic.
So yeah.
Let's talk about dental school in terms of the challenges. What are some challenges that dental students can face? Maybe starting with year 1, 2, and 3, and then separately covering year 4 and 5.
Yeah, I think that's a good way to break it down. So preclinical, so years 1, 2, and into most of year 3, I think the main thing that people grapple with is the amount of content and also the skills required to not only be examined on that content, but also to develop these what we call critical appraisal skills. So in dentistry and medicine, the way that we get information and updates in our profession is obviously through scientific research that's published on a regular basis. And everyone who, when they join dental school, don't know how to read through that and get what they need from a scientific paper. It's written in a very specific way, and it can be quite tedious to try and dissect it if you don't really know how. So I think the idea of those preclinical years is to kind of get you into the routine and the habit and find the technique to kind of go through scientific literature to find out
This is where we
exactly
get some evidence-based dentistry from.
exactly, and that's the way that medicine is practiced in this country, and dentistry should be as well. So that's the kind of main challenge, and there's no real shortcut to developing that skill. You just have to put in the hours and the effort, and also find the right people at dental school to help you, because there's so many at teaching hospitals. There's so many professors and lecturers and tutors who will teach you how to read a paper, and you can even find resources online if it's just a simple Google search. How to read a paper, how to get the relevant bits of the paper, because they put everything in there, their methods, their results, their discussion. So you want to kind of focus in on the bits that are relevant to you, or else it'll take you forever to get through it. So I think dealing with that massive amount of content is the main challenge in the first couple of years. And my advice would be, especially in terms of exams, start early, plan to do little bits regularly rather than doing everything at the last minute like you might have done at school, because that won't work at university. I think dental school was probably the first time I saw a lot of people around me repeating years, failing exams. And that wasn't because they're not intelligent people or they haven't worked hard enough. Some of them worked really hard. It's just that your technique has to be on point. You need to start early. You need to break it all down, because otherwise it will overwhelm you.
Just on that point, because I think that's really important. Some people struggle with different learning styles, and I know you're saying start early, but is there a way that you can check that you're doing it in the right way? Is it sufficient that, from the lectures, that you'll know the right way and be able to apply the right way? Or do you need to be with other students who maybe are understanding it a bit better? How do you approach that?
Yeah, it's a good question. It's a tricky one to answer, because like you said, everyone has different learning styles. So I was always very wary of working in a group, because if you're with your friends, you can get sidetracked quite easily, and you need to be with a very disciplined group if you're gonna make it productive. Having said that, though, there are so many concepts in dentistry where it's so confusing, and having 2 or 3 people to kind of pat it out with actually does help a lot. And I know professors and examiners who actually recommend that, like, the benefit of group learning far outweighs kind of the detriment of it. But obviously, again, bear that in mind. If you're with like jokers and your friends, you might completely go off topic. So you want to try and keep it focused. So that is definitely one route that is really useful, because with difficult concepts, talking it out really does help break them down. And someone else will probably know something that you don't, and vice versa. In terms of checking your progress, the best way is just to do practice questions or past paper questions. Now, I know they're not all dental schools release them, so it's difficult. There are books out that have kind of multiple choice questions and short answer questions that you can kind of test yourself with, but I think they focus more on the 4th and 5th year content rather than your 1st and 2nd year content. You can also create questions yourself based on your lecture slides. That was something that I started doing. It's quite popular from those kind of YouTube study with me kind of tutorials that you see, where it's called like active recall, where you kind of read a piece of information and then you kind of generate your own questions, so that when you comes to a later date, you can kind of try and answer them to see how much you've retained, and anything that you haven't, you can kind of flag up and revisit. So it's a good way to kind of make sure you're not repeating stuff that you already know. I approached it quite traditionally though, like, you know, lecture slides, make kind of condensed notes, and then try and memorize those notes, or test myself with past paper questions.
Okay.
And that tends to work for me.
Yeah.
And I think your department will also kind of help you out in that regard.
So you'd say that that's one of the main challenges in years 1 to 3,
Yeah, I think it's
really getting into the research and being able to take the learning points from it and
yeah.
apply it to your practice.
Yeah, I think also a lot of students sometimes they don't see the point of a lot of the preclinical stuff. You'll obviously appreciate stuff when it's in the context of a patient and patient care,
Mm.
but you know, when you get kind of the development of the tooth, or like histology, like these kinds of concepts that you probably won't specifically revisit, but a lot of them do lay the foundations of what is talked about later. So you kind of need to
Yes.
have that basic understanding of these concepts. So
Mm.
my advice is just to be patient and bear with it, because yes, you might not use it in the future, but it will be the foundations for, you know, the stuff that you will use.
Now, with courses like dentistry, one of the daunting things for students is that you do year 1, that's okay. Year 2, you're expected to know what you learnt in year 1.
Yeah,
Year
yeah,
3, you're expected to know what you learnt in year 1 and 2 and 3.
yeah,
So it's daunting for students to think, you know, how am I going to be able to retain all of
yeah,
this information? What are your thoughts on that?
yeah. I think if we're being totally honest and totally realistic, I don't think I went back to first and second year stuff in third, fourth, and fifth year. I think the reason you actually end up retaining it is because the stuff that is important, you actually do it on a daily basis in clinics, and you repeat it naturally so much. And I think people don't appreciate that actually dentistry is actually quite similar to an apprenticeship rather than a university degree. You're very, very, very kind of doing the job, and you're very hands-on um, during the whole process. And that in itself is a very good learning process, because the concepts that you read about, until you apply them physically, they don't quite make sense. And then once you start to do them repetitively, you realize what it was that they were talking about in that textbook, and you almost then don't need to revise it, because it's almost ingrained in your memory from you doing it so often.
Yeah.
Whether that be kind of fillings and the nature of the material, all of this kind of stuff that you learn preclinical starts to come together when you start doing it on patients. And the stuff that you forget about, you have those questions that you ask your tutor live, because you're like, oh, actually, I don't know, why am I using this material? And
Yeah.
they'll tell you why. And then you'll be like, oh yeah, I won't forget that now, because I've now had to use that material physically, and I know why I'm using it now.
That's
So you,
so good, because it's almost like learning to drive. You know,
exactly,
you could read a book on learning to drive, but it's
yeah,
until you've got a driving instructor next to you,
exactly,
you're actually trying to drive, that
yeah,
things start to really develop. So
yeah.
that's quite good, I think. What else would you say? What would the next set of challenges be for dental students from, let's say, year 4 and 5?
Okay, I think now we get very specific to clinics. So I think it's a universal problem across the board at all dental schools now, and it's only really getting worse, which is lack of experience and lack of patience. Unfortunately, it's a combination of two things. Mainly, it's a combination of the way funding works in hospitals. So it's because as teaching hospitals and dental schools have postgraduate students, they I wouldn't say they're the priority, but I would say that obviously a lot of the treatments that are complicated generally tend to go towards them, because it makes sense that they're doing specialist training pathways. And I think the problem with
So just
undergraduate,
explain that for people that aren't aware about dentist doing specialist training pathways.
fine.
Yeah.
So you have dental school, which we all go through, and then after, once you've qualified as a dentist, you can do further specialist training, which is where you come back to dental school, but in a different department, and you do very complex cases under the supervision of professors and consultants to improve your skills. And then similarly, you graduate at the end of it like you did at dental school, but you've got the title of a specialist now. So they obviously also pay extortionate fees. I mean, we as students think we pay lots of fees, but postgraduate dentistry, they pay probably twice, if not three times the amount of fees that we pay. So the funding is kind of focused in that direction. And it means that we generally struggle to distribute the patients that walk through the door amongst the undergraduate dental students. And so I know for a fact that, you know, compared to 30, 40 years ago, the amount of fillings, extractions, root canals, crowns that I'm doing it's a fraction of what people were doing 20, 30 years ago. One of my tutors, in fact, said that when he came out of dental school, he probably had the level of experience in terms of treatments that, you know, someone beginning specialist training now probably has. The volume that they used to get through at dental school was just insane, because it used to be the case where patients would just walk through the hospital front door, and then anything that they needed was kind of done for them by the teacher, the dental students. Whereas now, I think dental schools are very careful not to steal patients away from people who are out there in general practice, who, in theory, the way the system works nowadays, patients should go to an NHS dentist or in the area, a high street practice or whatever, and get their treatment done there. And the only reason they should really come to hospital is if their case is too complex and they need to be referred to hospital. So you can see how they kind of miss out the undergraduate dental students, because we're not experienced enough to have the complex cases, but equally we don't really have a right for people to walk in off the street and just get free treatment from us, because that's not the way the system works nowadays.
And I guess you've also got the thing of, as a nation, the need for dental treatment has gone down in comparison to back then.
Yeah, and not in maybe every department, but definitely stuff like complete dentures, so people who have no teeth whatsoever. There's hardly anyone nowadays walking around with no teeth at all, because people are just, you know, more aware of looking after their mouth. Similarly, like there are statistics in some areas of the UK which show that decay is decreasing, because people, again, are educated, they're using fluoride toothpaste, and they kind of know how to look after their teeth. And that's a win for dentistry, in that patients are being educated. But I guess in terms of dental schools, it's the kind of knock-on effect where we don't necessarily get those complex cases or those extensive cases where, you know, if you went abroad and did dentistry somewhere like, you know, in probably somewhere that people weren't looking after their teeth as well, you probably get so much more experience. So it's kind of like, you obviously want the best for the public, but equally you want enough to train and gain experience with. So that's probably the biggest challenge at the moment, getting enough experience.
So what can you do to make the most out of the little you might be given?
I think, first of all, take your time. I think even at dental school, there's the culture of like wanting to rush or get quicker, but dental school is not the place to be doing that. Like dental school, you need to get your basics and establish them and know how to do things well from start to finish, no matter how long it takes you. You need to be able to guarantee that you understand the process from start to finish, and you can guarantee a satisfactory outcome. If you're trying to do things too quickly, you're going to start cutting corners, you might forget about stuff, and then you won't actually be in the habit of doing something correctly, because you'll just be so focused on doing things quickly. And that's how you get into bad habits, that you then forget kind of how to do something properly in the first place. So I'd say just take your time. And especially if you've not got that many patients, why not just take your time with your patient? You'll get more clinical exposure that way.
Why do you think there's that desire for students to want to do things quickly? What happened? What are your thoughts?
I think I'm going to blame the tutors in this situation. I think what happens is, a lot of the tutors obviously work in general practice on the high street, and there is a bit more of a way off in terms of time and cost, and you have all these considerations. And I think for them, they're thinking, right, this student is going to become a dentist in a fully fledged practice in a couple of years' time, so I need to make sure that they're efficient, because, you know, wouldn't it be lovely to have a person who graduates dental school who's very efficient, can work very quickly, because in a business setting that's very advantageous. So I think tutors almost feel like, right, it's my job now, whilst we're in a protective environment, to kind of get them quicker. But having said that, there's a lot of tutors who aren't into that kind of thing, and, you know, they do encourage you to take your time. But I think I would just say, learn how to do something properly, no matter how long it takes you, and then you can look at, you know, speeding up and whatnot. I think the second thing was be proactive. So one thing that I learned a lot from is, at King's we have a procedure where, if we want a patient for any kind of procedure, we fill out an application form and we give it to the administrator, who tries to book it in for us. Now, the frustration comes when they can't find a patient to book in, and so you basically have an empty slot that day with nothing to do. Now, the way to be proactive in that situation is to bring up a phantom head, the fake, you know, fake teeth that you can practice on, and practice on them, because it's not the same as a real patient, but it's still better than doing nothing. A lot of students will just go home, or they'll go to the library, but that's not making the best use of your time at this point in your career. You want to get your hand skills up to scratch, and you want to practice as much as you can, even if it's not on real teeth.
Mm.
So I always used to bring up a phantom head whenever I'd have a patient who didn't turn up or wasn't booked in for me, and I'd practice a filling or a crown prep. I'd take photos of it as well, because you can, it's a fake tooth. So that is a good way to kind of...
That's a really good point, because on the other side now, as dentists, we now pay thousands of pounds to go on courses where
Exactly.
we've got a phantom head,
Exactly.
and we're practicing these skills. You know, so you don't sometimes you don't appreciate what you have.
Exactly. At dental school, you've got all the materials that you'd want in the world, and you've got all the time, and you've also got access to these fantastic pieces of equipment, which, like you said, people pay thousands once you graduate to go on. And you even have access to speakers that people pay thousands of pounds to hear. It's just that they're at dental school for free and they're your consultants. So again, I would go and shadow some of them if I had a spare moment, and I didn't fancy practicing on a phantom head. There's so many ways to make the most of your learning, but no one's going to tell you or ask you, do you want to come and shadow me, or do you want to come and practice some more? So you need to have that proactiveness. And the final thing is to, before you get in that position where you don't have a patient, ask your final years or your older years if any of their patients need kind of simple care. So for example, when I was in final year, I had someone that I was making crowns for or a denture for, but they also had some gum disease and a bit of some easy fillings that they needed doing. Now, I did them in a session, but I could have equally given them to like a third year student if they'd asked to do the simple fillings and the gum stuff, and then just give them back to me and I'll do the dentures and the crowns. And we both benefit in that regard, because I don't have the time as a final year to be doing simple stuff because I need to get all my quotas done for the complex stuff. And the younger years just want experience. So why not just give it to them? It's not like anyone's losing out in that regard. So
Talk to me about that. So if I was a third year at King's,
yes,
could I approach a final year to say simple things, just pass them on to me, and then you can carry on with the complex procedures? Is it as simple as that?
I would, yeah. I mean, basically, in King's at the moment, anyway, we're organised in teams. So if you're on the same clinic floor as me, you're in the same team as me. So patients can be passed within teams, but they can't be passed from different teams to one another. So I wouldn't go to older years that aren't within your clinical floor. But if they're on your clinical floor, by all means, because the way that the hierarchy works is, if I, as a fifth year, put in a request for a patient, I will be prioritized because I'm a fifth year. A third year will be bottom of that pecking order. So, you putting in a request, probably 70% of the time won't be filled if there's no patients. So you're more likely to get a patient by asking a final year who's priority for the simple stuff. And obviously, there's a trust there that you respect that and you don't do something that's more complicated than, you've been asked to do. But if you respect that, then yeah, I think you will get 50ers who will have too much on their plate, and they'll be more than happy to give you the easy stuff to sort out, because especially with complex cases, you need to sort out the simple gum stuff before you can start to even plan the more complicated stuff. Otherwise, it's the way treatment planning works. So definitely approach older years, be proactive.
What would have made you feel comfortable handing over a patient to a third year?
I think if the third year understood exactly what they needed to do, and that was that, I would be more than happy to do it. Because if I told them, look, they need a filling on this tooth and they need generalized scaling, take it away, I'd be more than happy to give that patient. And in the slot that frees up, I can book a second patient that's on my books to sort out their care whilst that one is being done. And then next week I can book in that last person that I transferred to the third year. So it's actually a really good way of managing your books as a final year, because you often have more patients to deal with than you have spaces in your diary, because you're rotating between different clinics. So, it's almost like smart delegation as a final year, if you can kind of hand off to younger years that need the experience. But admittedly, it won't always be possible. There will be some points where, for example, a case presentation, you have to do all the work yourself, so you can't give that off to another student. But I'm sure there will be cases throughout the year where you can give it to a younger year, and a younger year just needs to be proactive enough to ask. Because me as a 50, I'm not going to walk down the clinic being like, does anyone need a filling, or does anyone need gum treatment? It doesn't work that way. So I think you should be proactive.
That's good. Any other unique challenges faced by, let's say, fifth years, final years, that you can think of?
I think one thing that I massively benefited from, which I think a lot of traditional university tutors and professors criticize, is social media.
Yeah.
So, everyone's heard of this term of like Instagram dentist as like, it's a bit of a condescending term for people who don't practice perhaps the best dentistry. But actually, I would say there's nothing wrong with picking up stuff from other clinicians that are out there. I mean, we connected over social media, which is amazing. And it definitely does add value to your career and your dentistry. The only kind of disclaimer I would give is that anything that you might pick up, just look up the evidence based on it so that you know that it's legit and that you can practice it safely. And also run it by your tutors, because it is probably something that they know about, but they probably just haven't told you about because they think maybe it's a bit too complex for you, or it won't be relevant to you at this point. But you can learn so much in terms of techniques. And dentistry also, there's a lot of experience and preferences that people have in dentistry. So your tutor might have one preference, but that's not the only way of going about things. I think as a dental student, you can be really easily influenced by one clinician, because they practice a certain way and also they teach you their way. And so in your head, you're like, okay, that must be the only way to do a filling, or that must be the only way to do a crown prep. But actually, there's probably 6 or 7 different ways to do the same procedure. And until you go out there and expose yourself to such a diverse range of dentistry, you won't necessarily learn those things. So much I learned from, going outside of dental school and attending student conferences, speaking to other clinicians. You learn so much from others, and you can always bring that back with you to the clinic. And I found that really fun also to do.
Tell us a little bit about that. So the different societies you can get involved with and conferences you can go to and be a part of. Tell us a little bit about those opportunities.
So I think a really good thing that's happening nowadays, a good trend, is that traditionally a lot of these societies were very focused on dentists who had qualified and educating them. But now they're trying to now bring students into it, because they recognize that students are not only a great marketing tool for them, but also if you get involved with these organizations, obviously you're going to engage with them as a dentist and pay their membership fees or whatever they want. So it makes sense to engage with the younger dental students, whereas before they didn't. So for me, like a big one that I got involved with, and I'm glad that I did, was the BACD, so the British Academy of Cosmetic Dentistry. They, I think, in the last couple of years have really led the way in terms of organizing. They have a Young Dentist Day, which is like a conference literally for young dentists. They make it very cheap and very affordable to attend. And they have a whole host of like really good speakers, just teaching stuff that you know about and you're a little bit familiar with, but you perhaps don't know it in a lot of detail. How to isolate teeth properly, how to do clinical photography, like fundamentals that every dentist does learn at some stage. But why not learn about them whilst you're at dental school and be able to practice them at dental school? Occlusion, just concepts that they give you introductions to, which qualified dentists will have more extensive training on through this society. But it's nice to get that kind of introduction to it, and you feel a little bit like, right, I get this, like it's very clinical. And they obviously offer like awards and competitions and all that kind of stuff, and the whole networking comes into it as well, which is something that I cover in my book. And that does go a long way in dentistry and in any career, having a network, a strong network.
I also want to talk to you about being the dental student of the year, and also the BACD Rising Star. So tell us about that. How did that come about? How does that happen?
Okay, so again, in my book, there's a whole chapter on kind of awards and applying for awards, because it's a very interesting process. And I think, especially to dental students, when you mention awards, I think a lot of them roll their eyes and they think, what is winning an award going to do apart from having like a fancy, trophy or plaque on your wall? Like, it's not really going to benefit you in any sort of way. But I think the angle that I've approached it from is that it's not so much winning, or what it sounds a bit kind of cheesy. It's not winning that counts, but actually it's more the process that you go through, because all throughout your life, you will have to submit stuff for assessment, for applications, for whatever. And being familiar with that process and refining that process and getting better at it, you can only do that with practice. And so applying for awards is as much about the process as it is about the final result. So the BACD Rising Star, for example, that was an essay-based competition, and it was on the topic of white spot lesions and restoring them. So what skills that basically tested for me was critically appraising, searching for dental literature, and putting it across in a way that's presentable and informative. And I learned so much just from the process about managing white spot lesions. I learned about icon, I learned about whitening, all of these kinds of concepts that they actually have a clinical benefit to me as a dentist. But also there's people reading my work repeatedly. If I keep applying for awards, the same kind of people will be reading the same submissions. And again, it's a form of networking. People become familiar with your name on awards applications. They're like, oh, this guy's always putting stuff forward for awards. He sounds really proactive, or his work was really good. It didn't win this time, but I know that he can write, or I know that his work's pretty good.
Yeah.
And then when it comes to applying for jobs in different areas, chances are someone will know the person offering the job opportunity who can give a recommendation or can offer a word of, encouragement. Oh yeah, I know Zain. He's pretty good because, I've seen his name about quite a bit. So it's kind of a way of putting yourself out there, but also learning from the process, especially the essay and clinical based awards where you have to submit your own work. It's kind of like a reflective process or a reflective piece, and your own skills improve during that process.
Yeah. And dentistry is such a small community. Once you know a few dentists, there's actually a lot of dentists that you then do know as a result of that. And I think it makes you stand out. If you're applying for jobs and you're able to put that down, it makes you stand out from all the other dentists they've all got a BDS. We've all got a BDS, and it gives a talking point as well. So much more that you can get out of that.
I view it very much like, I view the award itself or winning as like the cherry on top. So it's lovely to have that. But people make a point, which is the right point, which is that these awards don't mean much in terms of your ability as a dentist. Like the fact that I can write an essay on white spot lesions, that doesn't translate necessarily into the clinic, but it's more the point that you're connecting with clinicians through these processes, and you're also improving your own knowledge and your own kind of your own abilities. Stuff like Dental Student of the Year, that's more of a CV based application basically. So for that, I didn't necessarily have to submit clinical work or write an essay for, but they had specific domains that they were asking, what have you done to benefit your community? What have you done to benefit your own dental development? What have you done for, at dental school? What is it about dentistry that kind of appeals to you, and how have you kind of engaged with that? So it was one of those more kind of competency based applications, and it was like a big CV kind of submission that I was basically going for. And again, I think that award more than anything illustrates the kind of benefit of networking and putting yourself out there, because now there was a panel of like 8 to 10 people judging that award, and now they've all kind of had some exposure to kind of who I am, what I've done, and not from a point of view that, oh, like, look at me, how amazing I am, but also if in future they have something that they might need advice or help with, let's say they're writing a book, for example, then, they know that they can connect with me, they can message me, they're like, oh yeah, Zain did that, let me try ask him what he thinks. And so it's just a nice way of building that community around you. The award itself, it doesn't mean anything until the next year where the next dental student will be awarded. So it's not the award that really means much. It's nice to have on a CV and market yourself with, but actually it's more the process of connecting with people, because even at that award ceremony, there were probably about 150 other students, clinicians, people there. And it was lovely to be able to kind of meet and kind of network with them.
Good, that's good. And how we actually connected, LinkedIn, which you'd never think dentists are on LinkedIn. And it was with your book, Know the Drill. So I want to get into the backstory behind writing your book, Know the Drill. What inspired that? And I think also it's related to your uncle as well.
So there's a lot of different factors that went into it. I think in the immediate term, it was obviously lockdown, and I was kind of thinking of ways not to be productive, but kind of I was getting quite restless and agitated because my exams had been pushed back. I didn't have much to do. I was very much gearing myself towards sitting my finals in April, so everything was very dental heavy. And all of a sudden, everything kind of just stopped, and I was like, okay, what should I do? And my other half, Hannah, she knows that I'm really into writing, and that I've always wanted to like write a book or write substantial pieces of work quite regularly. And in dentistry, you don't quite get that. You don't get to kind of scratch that itch, because it's quite a hands-on kind of science-focused domain. And so I don't really get the chance to write often, and it's something that I've enjoyed since school. So I was like, you know what, I've got a lot of time. Why don't I write for a bit? And initially I wrote like an article or two for a couple of publications and submitted them. But then I think I got the idea that, okay, I end up giving quite a bit of advice to a lot of different dental students, either about kind of applying for awards, or kind of how to make the most of their time on clinics, or how I did this, how I did that. And I was like, instead of just kind of responding to messages, why don't I write something a bit substantial and explain it in as much detail as I want, rather than kind of what I can fit in 140 characters, for example, in a tweet or in a LinkedIn message. Let me kind of make something a bit substantial so that people can read it and hopefully get some sort of value from it. That's kind of thought process behind writing the book. I think the thing that was driving me and motivating me more than anything was the story of my uncle. So he sadly passed away last year from leukemia. He was diagnosed in about 2016 and passed away in 2019. So it was a relatively short course of illness from diagnosis till he passed away. And he, bless him, was actually someone who he had neglected his teeth quite a lot over his life. And he was always kind of like, Zain, I can't wait for you to finish dental school because you're going to do my teeth. You know how relatives say when you start dental school, all of them kind of want that to be lining up outside your clinic. But him especially, because he had so many problems and struggles with his teeth, he was really kind of looking forward to my graduation. So it was kind of a really nice way to round things off by ensuring that any kind of royalties or proceeds that I make from this book, are donated to this leukemia charity that we actually worked with during his illness called DKMS. They actually work to find stem cell donors for people with blood cancers, because those of you who are familiar with leukemia and blood cancers is that one of the ways to try and cure it is to actually get a stem cell donation from someone who's a match. So that in itself is quite a tricky process, especially for BAME backgrounds, because we don't have as many donors in our kind of cultures as Caucasians do. And DKMS really do kind of further that cause, and they have such a big marketing and publicity drive behind it. We did some fundraising events for them whilst he was ill, actually, to try and help find donors. So I thought that it was kind of an apt way to round things off, publishing this book, not only the year that I graduate, but also in his memory. So yeah, that's the kind of backstory behind it, and finally kind of it's ready, it's published, and it's kind of available on Amazon for dental students to get involved with.
What I'll do is I'll put if you send me the link, I'll put it down in the description as well, and people can always click on that and on your other platforms as well, just to get in touch with you. So with the book, just tell us some of the things that you cover within the book.
Okay, so with the book, I kind of structured it to try and make it follow the kind of course of dental school, because I feel like it shouldn't just be for 4th or 5th years. It should be fun for everyone, whatever their stage of dental school. So
could you start looking at it before dental school as an aspiring student?
I think you could, but I think a lot of the concepts wouldn't be very familiar to them, because they cover kind of things that you are exposed to at dental school and then maximizing them. But I mean, it's not a bad thing to have on hand, because I mean, the earlier you read it, the more time you have to kind of maximize that opportunity at dental school. So I would definitely recommend it to any dental student. And then, yeah, if people are kind of looking really strongly to apply to dental school, then it will be useful to them once they get in. So it kind of starts off with a little bit about kind of who I am. And also, I think I define what success means, because it means different things to different people. Some people might view success as having a massive personal profile, earning a lot of money. Others might see it as having a work-life balance, being very clinically skilled. So people have different criteria for success. And I think I outline kind of what your criteria, you should outline what your criteria should be. And I give some examples of that. And then we kind of talk about the main things. So kind of applying for awards, pretty much start to finish. There's 3 different types of awards that kind of crop up during dental school, and how to kind of structure your applications for each one.
And these awards, do people eligible from year 1, or do you have to get further down the line?
Yeah, that's a good point. So I cover that as well. So there's some awards, for example, that you only become eligible for once you start clinics, because they revolve around your clinical work and taking photos of that. And then there's ones like, for example, essays, where you can start from year 1, because anyone can write an essay, and you probably have more time in year 1 than any other year group to kind of dedicate time to these things. I then actually move on to operative skills, which is a really fun chapter to write, because I use some photos, diagrams, and kind of just very I kind of very briefly outlined some skills that really benefited me that I learned from kind of other clinicians, social media, attending conferences, things that on a day-to-day basis in dental school will really, really benefit you. Isolation is a really good example of one. So there's a kind of like handful of skills dotted around in that chapter with some diagrams, with some photos of how to do a certain procedure, and also references in terms of what to look up further to try and get an appreciation of it. Because you could write another book on operative skills just on its own because it's so extensive. Then we kind of move on to clinical experience, so a little bit like what I talked about, kind of maximizing your clinical experience and exposure on clinic in dental school from years 3 to 5. And then kind of moving on to networking, a bit about entrepreneurship. So, talking about London School of Dentistry and some of the other projects that I've been fortunate to be involved with. And then kind of just rounding things off with kind of pitfalls to avoid that people always kind of fall into, establishing a work-life balance and kind of mental health. I think that's something that people don't appreciate. In a 5-year degree, which is a long time, you have ups and downs, as with any aspect of life. There's always ups and downs, and kind of knowing who to contact, having a support network, and kind of just highlighting the importance of that. Because I think when you're young and you haven't been hit by kind of life, you can kind of take it for granted, and then when it happens, you're a bit like, oh, what do I do? So I think it's important to kind of cover that, especially towards the end of the book. And then just kind of wishing people luck and giving them my contact details if they ever want to get in touch or discuss things.
Fantastic. I think it sounds, from what I've heard you say on different topics, that it would really be worthwhile getting and digging into. In terms of the book, do you think that you might do a part 2 after some years of practicing?
At the moment, I'm done. I'm like I'm ready to kind of start actually working. To be honest, I'm looking forward more to just starting with patients and starting the real kind of deal with dentistry. I think it's highlighted to me that actually I do really, really enjoy writing. I find it very fulfilling, and also it's not as intimidating as I thought it might be to kind of push something like that out there. And so it definitely does ask the question of, in future, is this something that I might be interested in doing further? I'm definitely going to try and write a bit more for kind of, short articles, publications, that kind of thing. Opinion pieces. I feel like dentists are very cooped up in talking about dentistry, but actually there's so much more to discuss and so much more that people are into. Like, I didn't realize how many people have side interests in dentistry that I also have, and I feel like there's not enough of a conversation around those things. We don't always have to talk about dentistry, so
it's actually really interesting. The more I'm exposed to different dentists, the more I see that there's more to us individuals as dentists in terms of what we do. So whether it's entertainment, some are, singing dentists are in entertainment. Others like yourselves, more authors. There's such a wide diversity of what dentists can get up to outside of dentistry, and it's really exciting and interesting to find out about.
One thing I covered in the book as well, I was like, dentists are perhaps some of the most creative individuals that I know, but they don't realize that their creativity isn't limited to the walls of their surgery. They can be creative outside of dentistry, and I think that's something that Singing Dentist is a really good example of it. Like, he's done very well because he's combined his passion of music with obviously his career, which you don't always have to combine the two, but it just shows the value of kind of exploring your interests outside of dentistry and how fulfilling that can be.
So I know it's still early days, but what are you looking forward to in your practicing career? Are there any certain pathways you're thinking of taking, or are you I just want to enjoy it all for now and see what happens?
I think when you're young, it's very exciting because there's a lot of different pathways open to you, and then as you get older, you kind of start to narrow it down a little bit. I recently heard a dentist actually say that in dentistry, there's kind of 4 main areas that you can dedicate your time to. One is like a career in lecturing. One is opening your own practice. One is your family and your family life. And the last one is yourself. And I remember him saying, he was laughing to himself. He was like, you can only choose probably 3 out of the 4 in those domains. You can't have.
So repeat those.
So 4 domains that you can concentrate on. You're opening your own practice. Having an extensive lecturing career. Focusing on your family, and focusing on yourself, like your own mental health.
Yeah.
And he was like, you can only choose three, really. People try and say that they have all four, but often they're neglecting one of those four. But obviously, no one admits to it. And I found that quite interesting, because I was like, that's the thing with when you're young, you think that you have like no responsibility and you can just kind of throw yourself into your career and all these things. But obviously, as you get older, you have more responsibilities and you start to realize that there's other things that are more important than just dentistry. And I think
Yeah.
that's something that I'm acutely aware of as well, like kind of making sure I don't spread myself too thinly. But I'm definitely at this point open to obviously all options, and I'll see where my career takes me. But
Yeah.
it's also important to bear in mind that there are other things that are also important in life. So
Yeah.
yeah.
Well, no, fantastic. Thank you very much for your time, sharing your dental journey and the book as well. Guys, make sure to check that book out. I'm sure we're gonna talk in the future and keep the communication. I've enjoyed hearing your dental journey. There's quite a lot to it. But no, just one final time, just let us know where we can find you, and then we'll be done.
Thank you for having me. It really means a lot. I've also really enjoyed it. In terms of where you can find me, so on my Instagram, Dr. Zain Rizvi on Instagram, and also my email, which is zainrizvi@hotmail.com.
Awesome.